GP clinics that were opened over the Chinese New Year holiday saw a surge in walk-in patients, some with acute respiratory infection. Well, this was the queue outside the Inter-Medical COVID Clinic at Hougang Street 21. And one Northeast Medical Clinic saw more than 10 positive ART cases yesterday morning. There was also a sign at its Sengkang Square Clinic saying that registration had to be stopped due to an overwhelming number of patients. Dr. Tan Teck Jack, CEO of Northeast Medical Group, joins me now. Dr. Tan, what's the situation today compared with the first 2 days of Chinese New Year?
As expected, we have a bit of an uptake in the absolute patient numbers. At the same time, the acute respiratory numbers have also gone up quite a lot. In fact, this morning, some of our clinics are seeing like more than 20 cases of COVID positive cases.
So I understand Northeast Medical's clinics have also seen 2 or 3 times more COVID-19 cases than at the start of the year. Dr. Tan, what is the condition of these patients though?
Okay, most of these patients are very well. However, the interesting thing about them is that most of them complain of an initial sore throat, which is quite different from, say, previously when we see the other COVID patients. We are treating them as for mild cases, right, is to get them to stay home as long as they can and for the symptoms to resolve. And they are also doing their self-test at home, and that really helps to alleviate some of the situations, say, in the hospital. We're trying to keep them at home so that the hospitals do not get overwhelmed. So yes, we are treating them as well cases who can recover from home.
Well, is there a difference between how serious a patient is now and how serious they were back then during the Delta wave?
I think when we were going through the Delta wave, we could see that a lot of the respiratory symptoms can be quite serious. Currently, this wave of Omicron cases, we have seen that the cases are fairly mild, and mostly, like I said, it starts with a bit of sore throat and very little else. And patients are generally very, very well, in fact.
Well, Dr. Tan, with GPs now having a bigger role in treating COVID-19 patients, how has that affected your clinic's operations?
I think GPs have been working very closely with Ministry of Health since the activation of PHPC, pandemic clinics, about 2 years ago. It is an example, really an excellent, how the private and public relationships, right, the partnerships have built capacity to cope with the demands in the pandemic. So our clinic operations are still very challenging because there's a need to deal with so many changes along the way. But there's another thing, which is the manpower shortage. Just like any other industry in Singapore, as doctors, we really hope that patients can be more understanding, and especially that a lot of medical care cannot be rushed.
Well, thanks so much for your time, Dr. Tan. Dr. Tan Teck Jack, CEO of Northeast Medical Group.